Good afternoon, everyone. Welcome to Veteran Homelessness 101. This webinar is part of a series of webinars by the National Veterans Technical Assistance Center, also known as the NVTAC. My name is Cindy Borden. I'm the Director of Technical Assistance and Training for NCHV, the National Coalition for Homeless Veterans. And with me today is John Rio. He is the Senior Associate from Advocates for Human Potential, AHP, and together our two organizations make up the National Veterans Technical Assistance Center, the NVTAC. We have quite a few folks joining us today. We're excited. We've got quite a lot of information to cover, so we'll go ahead and get started. Before we get too far into things, I did want to just go over a couple of logistical things. First of all, you may have noticed if you're trying to talk, we cannot hear you. As I said, we have about 300 folks on the call right now, so we do have your phone lines muted to cut down on background noise and to make sure everyone can hear. So you won't be able to ask questions by phone, but during the webinar you can use the question box that is off to the right of your screen there. You can type in a question there. We're going to sort of pause probably halfway through to look at some of the questions, and we'll leave a few minutes at the end as well to go over more questions. If there are any questions that we are unable to get to during the webinar itself, we will compile those answers in kind of a fact sheet and post them with the webinar itself. The webinar is being recorded, so if for some reason you have to stop and can't listen to the whole thing, or if there's something that you want to hear again, you will be able to do that. We will be sending out a survey email. As soon as the webinar is over, you'll get a pop-up that will ask you to take the survey then. We'd love it if you would do it at that point when things are fresh in your mind. But if not, you'll get an email most likely tomorrow that will have a link to the recording of the webinar and the survey itself. There's only 5 or 6 questions in the survey, but it really does help us plan and make sure that the content we're covering is relevant and useful for folks. So with that, I'd like to introduce John and let John take a minute just to introduce himself, and then we'll go through the agenda for today.
Thanks, Sydney, and I appreciate being here, and hello to everyone, and a happy July 14th. It is rapidly approaching the middle of the summer for all of us, and I'm glad we have a good crowd today who are interested in focusing on some of the rudimentary issues and challenges as we try to end veteran homelessness in our country, and how many of you who are working in programs in local communities are trying to find solutions and ways to help your veterans get permanent housing and employment and to have a life that they're satisfied with in their community. So glad to be here with Cindy on all of this, and this is kind of our agenda for the day. It's not particularly elaborate, but I think it'll do the job. Cindy?
Sounds good.
Well, let me start off, Cindy, a little bit just as a backdrop. If people don't know, homelessness is not a new phenomenon, although if you're new to the field, it doesn't mean that it's just been recognized within the last 10, 20, 30, 40, or 50 years. It's been with us back to the colonial era, to the time where our country was founded. So it's been with us for a long time, and I suspect that it'll be staying with us for a long time. But from time to time, we will see our economic conditions and housing conditions be such that we see increases in homelessness, and at other times we have the resources to combat that and to virtually end homelessness at certain points in time. But going way back to the 1780s, a New York City mayor at the time, Mayor Varick, who observed that vagrants, as the term was used, multiply on our hands to an amazing degree. Clearly, back at that time, there was overcrowding in jails and almshouses and workhouses that eventually led to the construction of some facilities to house individuals as early as 1796. But it was, it seemed to be a Northeast kind of phenomenon in many ways. But according to one historian, that was because it was mitigated, for example, in the rural South by the expansionism of the system of slave labor that we had. And so post-Civil War, we witnessed a more significant growth in homelessness nationwide. It's been said that even the words tramp and bum as applied to the homeless can be traced back to the Civil War era. So we've also seen the response to homelessness back then was often around changing laws and trying to create anti-vagrancy legislation to make homelessness a crime. And as it did then and does now, it doesn't necessarily seem like the best solution. But there was, in the late 1800s, a significant growth in reported vagrants. For example, in Boston, there were 100,000 at the approaching the turn of the century, more than 3 times the number in 2 years before 1874. So suffice that to say is that this is not a new phenomenon. Next slide, Cindy. So with the advent of the Vietnam War, the link between homelessness and military veterans really finally came to the attention of the general public, and much to the upset of the general public. It didn't take too long after the war to see waves of homeless persons, many who were younger and disproportionately black or Hispanic, appearing on street corners, in alleys, and in backwoods areas. In large measure, as you could imagine, people coming back from war, being unable to find employment after discharge, and at that time having unaddressed mental health or PTSD challenges or substance use disorders, as well as physical disabilities, that it was a huge concern and problem. And even more recently in the Gulf War, the early 90s, we still see veterans falling into homelessness in some measure for unaddressed disorders and problems that have occurred during military. There's been also an increased recognition that there were some undiagnosed problems before people went into the service. So for a host of reasons, we're seeing and have seen from the recent wars and recent events in Desert Storm, and after that, we're seeing service providers continually reporting younger veterans, more recently separated veterans, falling into homelessness. Cindy, you want to take this one, the next slide?
I got it. Thanks, John. So we want to give you just a little bit of context about the numbers that we're talking about when we're thinking about homelessness and homelessness among veterans. In 2014, you had almost 22 million veterans in the United States. About 10% of those were women. When you look at the point-in-time count from a day in January of 2015, about 565,000 people were homeless on that particular day, and just under 48,000 of those were homeless veterans. And then when you look at females, they make up about 8% of the homeless veterans. In just a minute, we're going to talk about, put this in context with where we were a few years ago, but this is where the numbers are sort of today, that snapshot. One of the things John just mentioned is that we are seeing some trends and some changes in what's happening with veteran homelessness. As he mentioned, we're seeing an increase in the number of women veterans that are homeless. We're seeing an increase in both younger veterans and also veterans who are recently separated. And those are not, they can be the same thing, but not necessarily. You can have a recently separated veteran who is not a younger veteran. We're also seeing older veterans that have chronic health conditions. As you can imagine, a lot of these veterans who have been homeless for longer periods of time are aging more rapidly and exponentially. And so the chronic health conditions of some of these folks are, they're aging prematurely. And so many of them are 60 but have the age of maybe an average 80-year-old. We're also seeing an increase, not an increase, we're seeing the effects of veterans who have a history of incarceration and who come out of that incarceration who have challenges finding employment and housing because of that history of incarceration. Many of those veterans do have mental health and or substance use issues as well. So it's important as we're looking at what the field is to have a good sense of what kinds of changes we're seeing in this population. I'm going to skip ahead a slide, John, and we'll go back to that trends in just a second. This makes sense. As I mentioned, I gave you those estimates of what the homeless veteran counts look like today. But if you look at this chart here, I'm going to try and use my fancy highlighter. If you look over here, you can see that in 2009, we had just over 73,000 homeless veterans at the point in time count for 2009. 43,000 of those were sheltered and just about 30,000 were unsheltered. You can see there's a tiny blip here between 2009 and 2010. 2009 was the first time that the point in time count specifically asked for veteran status. So it's the first year we have good data. But we learned some things in that year, and so there were some changes in how the data was counted. So that blip may in fact be part of that learning curve or the growing pains of adding veteran status to the point in time counts. But since that point, you can see how we've got this dramatic decrease in the total number of homeless veterans and also the unsheltered homeless veterans. Sheltered veterans has gone down as well, but there's almost a 50% decrease here in the number of unsheltered homeless veterans in that 5 or so year period. And if you look over here, what you'll be able to see is that represents between 2010 and 2015 a 35.5% drop in the number of homeless veterans. And that unsheltered count, as I mentioned, dropped by almost 50%. So the point of that is to say that we've made some really great progress in the last 5 or so years. But I think John and most of you would agree that we've made progress. That doesn't mean that our work is done. So
yeah, no, hardly. Our work is not nearly done, Cindy. If you could go back to the slide before the chart, just to quickly acknowledge all the work of people on this call. I'm assuming that many of you are affiliated with a continuum of care. If you are, give me a response in the chat box. Let me know. Are you in any way affiliated with a COC, or is your agency a member of a continuum of care? Let us know. We'd really like to just hear from you for a minute about your connection with the continuum of care, because it's been through our systems, that data, the data that we've been able to gather, this has been phenomenal. If you recall, some of us who have been at this for many, many years or decades, you know, we never had this kind of information to know about our impacts. We're now starting to share databases and be able to communicate with each other through electronic data and management information systems. you know, this is a big event, you know, between homes at the VA and HMIS at the COC level. These are great tools for us to be part of and to be using and getting this data. So I know it's burdensome because some of you would tell me, yeah, but I have to enter data into 3 or 4 different databases. Well, step back a minute and take our appreciation for your efforts to do that, because it's what yields this kind of information and data, so it's much appreciated. There's also been, in these wider trends and national movements, you know, permanent supportive housing has grown phenomenally, and Housing First has also been the orientation of many of the new programs that we're going to talk about in a few minutes. And this is both the data and being able to have more information around the people we serve, and better practices. We are able to do a better job of targeting services to specific populations. So I think, Cindy, that's a big national movement that we've been able to do in these last so many years.
That's right, John. And just to follow up, we've gotten a lot of folks who are either members of their COCs, affiliated with their COCs, in some cases the lead agency of their continuum of care. So that's great. We're glad that you're all part of that network that really is making a difference in the lives of homeless veterans. So just to go back a second, to give you a sense of history of, I said we've made a lot of progress in the last 5 years, but a lot of folks have been doing this work for a lot longer than that. And really, when you think of the movement to help veterans who are homeless, that has evolved into the movement to end veteran homelessness. If you look back to the early 90s, late 1980s, early 1990s, there were a couple of things that happened. First, the Department of Labor actually started the Homeless Veterans Reintegration Program. At the time, there were no federal programs to help homeless veterans, and we'll talk more about HVRP in a few minutes when we talk specifically about the programs, but it really was one of the sort of first efforts at the federal level to address the issue of veteran homelessness, and it's really designed to help homeless veterans gain competitive employment. Also around that time, you have the first stand-downs and stand-down grants that are happening. And the stand-down is really an event to, it comes out of, historically, it comes out of wartime and Vietnam, the Vietnam War specifically, when military folks were in the front lines and fighting and were given a rest. They were told to stand down, and they would go back off the front lines and sort of gather and take a bath, do laundry, you know, have a good meal, have that camaraderie, that connection, and sort of rest and regroup. And the stand-down events are an homage to that idea of giving veterans, homeless veterans specifically, a place to come and feel that connection and to rest from the life that they lead as being homeless, but in the course of that to then also give them access to services. And so stand-downs are also happening around this time period, the early 1990s. And then also this is when the GPD program, the Grant and Per Diem program, was begun by the VA to sort of help veterans find, to get them off the street and get them into temporary shelter and housing. So as I mentioned, 2009 was the first time we had a veteran supplement to the Annual Homeless Assessment Report, the AHAR report. And the AHAR report is based on those point-in-time counts, those estimates. And for those of you who are not familiar with the point-in-time, it's a single night in January, and the folks go out to count homeless veterans who are on the street. Well, I'm sorry, the homeless that are on the street, and 2009 was when veterans were specifically, that folks were asked about their veteran status. It is a snapshot of homelessness. It is one night. so it's not comprehensive. And as you can see here, in 2009, there were 75,600 homeless veterans in the point-in-time count. One of the things, the point-in-time count is a snapshot, and so the estimate for 2009 was many folks cycle in and out of homelessness in the course of a year. So the estimate was that 75,000 for that one night represented about 135,000 that would have been homeless for at least a night during the course of the year. John, do you want to take this one, or do you want me to keep going?
Oh, sure. I can make a few remarks. I'm sure everybody on the call has heard of the United States Interagency Council on Homelessness and the federal strategic plan that was launched to have a national strategy across the United States to respond to the challenges of homelessness and to introduce the concept that perhaps, in fact, we could actually end homelessness. Some of you, are still in pursuit of that. Some of you, since the USICH went about this plan, there certainly has been a big dent put in the homeless problem, if you will. We see across the country the implementation of some of the strategies talked about by the USICH, as well as your own community's 10-year plan. And I think most of the communities that are represented on this call follow these principles to end homelessness and use them in everyday work that you're doing to provide the services you do. Cindy, I don't know if you want to add anything to that.
The only thing I would say is just to highlight those original goals of the strategic plan was to end chronic homelessness, both chronic and veteran homelessness, in 5 years, and then homelessness for families and youth in 10 years. And we'll talk about how the progress that's been made in that as we move forward.
And you know, Cindy, as well as I do, as you see in your next slide, that this has taken a tremendous effort across the federal agencies to work, together and in many instances in unprecedented ways. But during the last 10 years, federal agencies have been organized and focused through the USICH to address veteran homelessness as well as other homelessness among families or single individuals who are chronically homeless, etc. But this has led to the garnering of resources and the strengthening of resources across federal agencies. And we're hoping that as we move forward with the Workforce Innovation and Opportunities Act, or WIOA, that we see more attention given in local communities through the Department of Labor program to help people experiencing homelessness to participate in the labor market. Certainly, I'm sure you all have heard of WIOA. You may not know the ins and outs of it, but know that people experiencing homelessness is a priority population in that legislation. So we certainly should be looking to see new and better things happening with our partners in the American job centers and in the workforce systems. Next slide. The USICH, in its infinite wisdom, has, from time to time articulates and summarizes some of the things that are going on across the country or need to be going on. And in veteran homelessness, they've identified these 10 strategies. Other organizations have identified fewer than 10, but nonetheless, there's concurrence that these are very important strategies for your community to take up, and I'm sure many of you see yourself as part of one or more of these strategies. Probably right now, one of the leading challenges is in trying to look at the coordinated entry system in communities as your community now is responding to the recently announced HUD-NOFA, are going to try to be figuring out how do we have a coordinated entry, not only so that people in need of housing can access that housing more readily and in a streamlined way, but also how does a coordinated entry system address the need for services for people to maintain that housing. So these strategies, next slide, these are these 10 strategies. I'm sure you've had experience with them. We are all trying to work more with landlords than we have perhaps at any other time because we're short on subsidies. We don't have an adequate supply of vouchers for everyone who needs one. So we need to be working closely with landlords as partners, and to pay attention to strategy number 9 is how are we going to increase the income of the people experiencing homelessness. In large measure, the key strategies are around increasing income and securing permanent housing. Those certainly are bottom line critical activities, and I'm sure most of you are engaged in those. Cindy?
That's right, John, and just to add to that, I think it's really important as we're talking about ending veteran homelessness is remembering that that connection between housing and income, that to have stable housing you need a source of stable income, and to have a stable income often you need stable housing, and that those things are interrelated, and when one of those pieces is missing, it can quickly lead to loss of the other as well. What we wanted to talk about a little bit next is John had mentioned that under the USICH plan and the 5-year plan to end homelessness, there really was this garnering of resources across different federal agencies and different programs. And we're going to spend a couple minutes doing a highlight of some of the key cornerstone programs that are part of this effort on the federal level. First, in connection to the idea of rapid rehousing and prevention, I've noticed in the chat box that there are at least a couple of SSVF grantees on the line, but the Supportive Services for Veteran Families program, also known as SSVF, was launched by the VA in October of 2011. So it's a fairly new program that came out of this 5-year plan. And back in 2011, there was $60 million awarded to 85 grantees across the country. SSVF is designed to deal with those who are homeless, veterans who are homeless or at risk. And it really initially was designed to deal with crisis homelessness as opposed to chronic homelessness. So folks who are falling into homelessness because of a crisis situation, perhaps losing a job or family struggles like a divorce, those kinds of things, but shorter-term homelessness. There's an emphasis on rapid rehousing, so getting folks into housing very quickly, and then also prevention to keep them from falling into homelessness. One of the key things about the SSVF program is that it is designed to be flexible, so grantees can do different things. They're not all required to do the exact same thing with their grant funds. There are core services that most SSVF grantees offer, but there is flexibility within that. SSVF do outreach, they do case management, they do connect their participants to the VA for health care and benefits, those kinds of things. They connect them to supportive services. One of the unique features, I think, about the SSVF program is the ability to offer temporary financial assistance. It does not go directly to the veteran. It goes to a third party, but that could be used to pay a utility bill, for example, or to pay a security deposit for a veteran or a family who has the money to pay rent but doesn't have that savings to do, first and last month's rent, those kinds of things. To give a little bit of context, as I mentioned, in October of 2011, when SSVF first launched, it was a $60 million program. This year, in 2016, it's a little over a $300 million program. So you can see it's grown exponentially over the last few years. John, do you want to do the COCs?
Just both the SSVF and rapid rehousing in the continuum of care program. These were built on the fundamental learnings we had under the homeless prevention and rapid rehousing, the HVRP initiative of a few years back. So that was the predecessor to these programs. And I'm sure now in most communities we have some rapid rehousing. And I should also say that the emergency solutions grants can also help with rapid rehousing, and obviously they do prevention, but critical is how these programs work together through the continuum of care in a coordinated, strategic way. We all are still living under the interim rule under HART and trying to find our ways, and there's witness these next couple of months as people work on their HUD-NOFA. There's some new pieces to that that will prove challenging, but it's a very dynamic climate that we're trying to develop rapid rehousing and expand it. Ideally that across all of the 400 and some continuums of care. And as we know, the whole COC program is the core source of our housing assistance along with some other HUD programs. But the gears have shifted in the sense of looking to other federal agencies for service dollars and HUD being more focused on the housing assistance. Most communities are still struggling a little bit with that balance of how to coordinate services from other agencies with housing resources from HUD, and that continues to be a challenge, and I suspect will be our challenge for the next 5 years to get better at that. Next slide.
You want me to do this one, John?
You go ahead. Yeah.
Okay, so next we have Transitional Housing, the Grant and Per Diem program. I had mentioned this. This is one of the oldest programs that's around, federal programs that's around for helping homeless veterans. And the Grant and Per Diem program has two components to it. It began in 1993, and it was actually partially came out of a call from some HVRP providers, folks who had the Department of Labor HVRP grant, who were trying to connect homeless veterans to employment and realized that they also needed a place for those folks to, in order to get them competitive employment and keep the job, as I was mentioning earlier, they needed that stable housing. So it began in 1993. As I mentioned, there's two components. There's the grant component, which is construction grants, grants to build housing or refurbish housing, or in some cases, construction grant, special construction grants can be used for things like purchasing of vans to transport veterans. And then the other half of the grant and per diem is the per diem. And for those of you who know Latin, per diem, that means per day. And so the per diem part of grant and per diem is the transitional housing piece. It's a limited stay up to 24 months, ideally less than 6 months or 90 days, and it depending on, and there are other folks who say that per diem should be less than 60 days or even less than that. But it is designed to be short-term. It's transitional housing. It provides housing and supportive services. Veterans who are in the per diem part of GPD can be asked to pay up to 30% of their income as rent. The providers of per diem are reimbursed at the per diem rate. You can see it there. It's a little over $43 per veteran per day. So if you think of if I have 10 beds in my grant per diem transitional housing unit, and tonight there will be 8 veterans sleeping there. For tonight, I would get whatever 8 times 43 is, a little over $320 for tonight. So you're paid per veteran per day. That's where the per diem comes from. You've also probably heard a lot about the GPD program reboot that is coming soon. As I mentioned, GPD is one of the oldest programs. It's been around since the early 90s. And when GPD first started, there weren't any some of these other programs. SSVF wasn't around. The continuums of care weren't around. So it was designed when there was nothing else there. Part of the reboot is really going to be looking at what makes sense now that there are these other programs. What makes sense for GPD to look like so that it can be a little more flexible and actually reflect the systems and the changes and the other services that are available, so it's not duplicating services, but that it can meet the needs of veterans whose needs aren't met through the other programs. And that reboot is expected to happen in probably the next year or so. So I would just say stay tuned for more information on that. Did we, John, I think we missed HUD-VASH. Do you want to take HUD-VASH?
I think we did. I think we did. Many of you know the HUD-VASH program. It's significantly grown since 2008, and the number of vouchers has increased dramatically every year to provide more permanent supportive housing using a housing first kind of orientation for veterans who are considered the most vulnerable. Many or most are using the VI-SPDAT or some way to assess the vulnerability of their participants in HUD-VASH, but it's a program that's available in every continuum of care virtually across the country, with more than several hundred, 300 PHAs participating in it. So it was originally hoped for that it would meet the housing needs of chronically homeless veterans, and indeed the majority of the VASH units are housing chronically homeless veterans. But in the ramp up, I think early on, not all of the veterans that got a VASH voucher were or met the criteria for chronically homeless, but certainly most did, and as these resources expanded over the years. With the VASH is basically a housing voucher that's tied to a case management or supportive service delivered by a case manager. And most of the instances, those case managers are hired at the local VA. In some cases, they're contracted out to provide the kinds of support that veterans in a VASH unit might need. More recently, there has been a growing trend to look at and try to explore ways to increase the employment rates of tenants in the HUD-VASH as well as residents in GPD. So I think in the next 2 years, you'll be seeing and hearing more about that as the number of vouchers are not likely to be increasing as at the rate that they have been, and that the need for appropriate and day activity, shall I say, that is purposeful activity, that need increases, and the need for income amongst the VASH tenancy will spur more employment as we go forward. Back to you, Cindy.
Okay, thanks, John. We're going to move on to the next program, which is employment side of things. The programs that we've been talking about so far, housing side. Now we're going to talk employment for a moment. First, we are going to talk about HVRP, the Homeless Veterans Reintegration Program. As I mentioned, HVRP was actually authorized back in 1987. It is sort of the grandfather, if you will, of federal programs around to serve homeless veterans. It's funded by the Department of Labor and Veterans Employment Training Service, DOL-VETS, and it really has two primary objectives. The first is to place homeless veterans in competitive employment, to help homeless veterans get back into the labor force, but competitive employment. It's not supported employment, it's not CWT, it's competitive employment in the labor force. And the second objective of HVRP is to help to develop a service delivery system that can really help address all of the complex set of problems that homeless veterans have in really a systemic way. In program year 2015, HVRP provided approximately $37 million in funding. So if we're putting in context, I think we said SSVF has about $300 million, and the continuums of care have about, I think most recent funding announcement is not quite $2 billion. HVRP has $37 million, so it is a small piece, but nonetheless it's an important part of the system of services and the system of things available for homeless veterans. And HVRP is really client-centered. It's focused on coordinating the effort and connecting veterans to all of the services that they need to support them in rejoining the labor force. So connecting them to housing, connecting them to mental health, medical care, all those sorts of things. And HVRP follows the job-driven training approach. So it's really not just training a veteran, but training a veteran for a competitive job that actually exists in the locality where he or she is. If we look at a snapshot of the previous program year for HVRP, you can see that it was just over 20,000 veterans were assessed to possibly be enrolled in the program. Of those, 17,000 were enrolled, and you can see the breakdown of male and female there, and also the breakdown racially of veterans that were enrolled in HVRP for last year. One thing that's really unique about HVRP is the placement rate that HVRP has been able to maintain for the last few years has been in the over 2/3 of participants in HVRP are placed in competitive employment. For this most recent program year, across the program nationally, the placement rate was 67%. And that did not vary too much by race or gender. Men had slightly higher placement rate of 69%, and women's was slightly lower at 66%. But when you look across races, the range is between 66 and 70% across the racial groups. So the program really has been able to place homeless veterans in competitive employment at a very high rate.
Cindy, we should also note that the average hourly rate of pay for veterans in the program approached $11.85 per hour on average. And the national average of the cost per placement, or that how much resources was required to help a veteran get into a job, averaged about $2,900 per participant. So that's some backdrop, to that.
That's great, thanks, John. Thank you.
I should also let me introduce the VA's Homeless Veteran Community Employment Service. That may be something some of you have heard about, but I'm sure not all of you. It reflects a new initiative out of the Department of Veteran Affairs to try to strengthen the work they do around employment, and simultaneous to the establishment of this new service, the VA is also looking at transforming all of its employment programs under VHA. So that's our CWT and TWE programs, if you will, the compensated work therapy and transitional work experience programs are going through a transformation to try to become more community focused. So don't be surprised if you hear and see more of the VA out in your local workforce system and trying to participate with HVRP or with American Job Centers in trying to address the employment needs of veterans experiencing homelessness. So the Community Employment Service for homeless veterans, there's a link on the page here that you'll be able to go to and find who is the Community Employment Coordinator for my area, for my VA Medical Center. And those CECs, if you will, Community Employment Coordinator, is charged with developing and supporting a local community response for veteran employment. So they're out there in your community trying to organize strategies and get collaboration to address the employment needs of homeless veterans. So you should be hearing more about them.
Great, thank you, John. This next slide is just really sort of a visual representation to show how in the past you see veteran homelessness as an issue there in the center in the red circle. And there was some overlap with folks who worked on veterans issues and with folks who worked on homeless issues, but there was a whole bunch of covered. And then all of these other related fields, healthcare and prevention and affordable housing and employment and legal services, and all of those things were sort of off on their own. And if you think of a veteran trying to navigate the system, if the veteran is coming in, say, through VA healthcare over here, they may connect to other veterans programs, but they might not connect to all of the space that you can see in between here. There's lots of places here for a veteran to get lost and not make it to all of not have access to all of the services that he or she might need. And the idea that John had been mentioning earlier about this coordinated access, coordinated entry, and really having a holistic approach, what we're moving towards and want to, get closer and closer, and as a field we're moving closer is, yes, we have veteran homelessness here, but everything is touching. It's all connected. The picture might still have a slight space here and there, but it really is a safety net, a way that all of the services that a homeless veteran might need are connected to each other, and so that there's no wrong door. If a veteran comes in one place, he or she will be connected to all of the things that they need without being sent out and saying, oh, well, for that you need to go, take this bus and go over there to do that. That the connection is much more seamless. So I'm sure many of you have heard, as part of the 5-year plan, the goal was to end veteran homelessness. And so I'm sure many of you have heard this idea of functional zero, that we're at functional zero, we're approaching functional zero. And the definition from USICH, just to be clear, functional zero, when we say that we're arriving at functional zero, as an end of veteran homelessness is at functional zero in X city or community, we're not saying that no veteran will ever experience homelessness again. That's not what ending veteran homelessness for the 5-year plan means. What it means, and there's a quote here that you can see from USICH, but it doesn't mean that they're never going to experience that housing crisis. But what it does mean is that the community has a system in place and a response in place to make that incidence of homelessness as brief as possible if it happens, and to prevent it when they can. So it's to prevent it, to make it, if it does happen, to make it as brief as possible, and to keep it from recurring so that it is sort of an isolated experience. So it's creating the system in order to do that. And it's making sure then that the community has the capacity to identify who's currently homeless and who's at risk of homelessness. As John had mentioned before, the idea of a master list. It's to intervene to prevent the loss of housing when that can happen, and divert people from even entering the homeless system at all. When someone does fall into homelessness, it's being able to provide them immediate access to shelter and crisis services with no barriers to entry, and trying to find permanent stable housing, housing them, but then working quickly to find permanent stable housing. And it's really that quick connection to other things. When we talk about functional zero in connection to veteran homelessness, it's really important to remember that one of the key components of this is veteran choice, that the veteran is choosing what his or her path, and that our role is to sort of navigate and give them access to all of the possibility, but the veteran gets to decide what is best for him or her. And it's also focusing on the system, creating the system, and then making sure that that system is stable and can be maintained over time. John, did you want to add anything to that?
You can go to the next slide. I think we just see an increasing number of communities try to reach this level of effort. And we should also say that this is dynamic. That is, if this month or this quarter you end veteran homelessness and are at functional zero, that picture could change in 6 months or in 2 months. It depends on how your system is responding to veterans who fall into homelessness, as well as how you're managing the resources to respond to veterans when that occurs. So you could clearly see that you could be having a quarter in which you lack the resources to respond, and so you would not be a community that has ended veteran homelessness per se, if you can't promptly respond with rapid housing of veterans falling into homelessness. So we're learning a lot as this goes forward, and the federal agencies, and the USICH in particular, is looking at these issues. But clearly we have a couple of states and 24 communities that have arrived at this, if you will. We certainly hope that they are going to be able to sustain an effective response. Next slide. Well, let me just say a minute about this. We're borrowing from our friends and colleagues over at the National Alliance to End Homelessness. They've developed this interactive map recently. If you haven't seen it, please go take a look at it. It helps to track this, the communities that are working on ending veteran homelessness. And you can see which communities are reporting a decrease, which communities are experiencing an increase, and others that are receiving SSVF dollars and the impact of those resources in those communities. So if you're interested, this is, just gives you a good national picture of the efforts to end veteran homelessness.
Thanks, John. And this slide here is just, again, to show everyone, and just as a reminder, that as we've been talking a lot about big federal programs and all those sorts of things. But at the end of the day, what we are trying to do is end veteran homelessness, and that means that the veteran has to be at the center, that all of our approaches should be veteran-focused and should focus on the veteran being in the center and everything else supporting him or her in his or her efforts to find housing and find stable housing and stable employment, and to maintain that housing. So that's just a visual representation of that we do make sure that we keep the veteran at the center of everything that we're doing.
Well, this is a slide just to inform you, if you're not already aware, that Cindy and I are part of a technical assistance center, the National Veterans Technical Assistance Center. Is located at its website, www.nvtac.org. And we encourage you to check out the website and the variety of information that you'd find there. This website was designed to support the HVRP program as well as stakeholders, and there's a variety of information here on the website that you might find useful to you. Next slide. And our TAC is focused on these kinds of major tasks. So we're here to try to help grantees improve their efforts and be successful as they can. We provide on-site technical assistance and training as well as virtual and remote experiences. For example, we're planning in cooperation with our regional DOL-VETS offices to deliver some post-award conferences that are coming up. A couple of face-to-face ones next week that Cindy will be doing, and a virtual one for Chicago the week after that. So those are the kinds of things that we're doing to try to help support our HVRP community. Next slide. If you want to get in touch with us, go to our website and click on the Contact Us, and you will find information about me as well as Cindy and the other staff that are working on the center, and how you can request technical assistance. TA is primarily targeted for the HVRP grantee and stakeholders, though you'll find us to offer kind responses to anyone who's making an inquiry about helping homeless veterans return to the work world. So we welcome your communication. Cindy, how are we doing on questions?
We have just a couple minutes left. One easy question that I will answer for everyone. The webinar, as I mentioned, has been recorded, and it will be posted on the NVTAC website. It will also come to anyone who registered through the link. You will get an email tomorrow with the survey link to take the survey, and there will also be a link to the recording of the webinar itself, so you can watch it again then or share it with other folks if you'd like to do that. We did have one question around eligibility for HVRP in connection to housing and other folks. And Donna, I can start, and if you want to add in. The question was around with Housing First and the move to get folks housed immediately. What often happens is a veteran is housed and then goes to an HVRP program to try and enroll and get help with employment, and they are no longer eligible. And that is true. For HVRP eligibility, you do need to be homeless or at imminent risk of homelessness to be eligible for the program. And what we encourage all HVRPs and also anybody who's an SSVF program, or if you're at the continuum of care, if you're at a GPD, to work with your local HVRP program so that as you're admitting a veteran, it can be connected to that HVRP program and enrolled before they are housed so that they don't lose access to those resources and the training and that employment assistance that the HVRP can provide. And I'm glancing to see what other questions we have. One person had a question about how coordinated entry works and if HVRPs and other programs are how they are able to connect to the coordinated entry system in their community.
Sure, Cindy, I can comment on that if you would like. Under the HEART Act and the COC program requires communities to develop a coordinated entry process for people who might fall into homelessness. That is, they have a place to go where all of their needs might be met, sort of a one-stop shop or a no wrong door kind of thinking behind the coordinated entry. Most communities are starting to talk about it or are implementing a coordinated entry process. And you'll find more commonly that it is at first about access to housing. So the coordinated entry effort is around the housing resources in the community that people may require. They should also be addressing the service needs of clients or of anybody who comes seeking assistance from the homeless system. And that also means those who need income. And so we see some coordinated entries starting to address the notion of income and housing. And income may be earned or unearned. So for example, for those that are needing unearned income or money from entitlements, resources like the SOAR initiative to access Social Security benefits is part of the coordinated entry process. Or the local workforce system is contributing and partnering with the continuum of care for the American Job Centers to be a resource for people who need that kind of service as they come into the homeless assistance system. Those are not the only ones. There's other local providers that are involved in some of these employment service efforts at coordinated entry. Your best shot is to start conversations with your COC leads or staff at your COC to begin conversations. And if you're an HVRP program, you should be having that conversation and exploring ways in which you will be a resource for that system. As veterans fall into homelessness, they're going to come to the attention of the coordinated entry portal. And as such, you want to make sure that your employment service is available to that veteran who might come into a shelter or into a coordinated entry intake. You want to make sure that you're seen as a resource in the mix. So reach out to your continuum of care and have that conversation.
Thank you so much, John. We are a couple minutes over time, so unfortunately we have a couple questions we didn't get to. What we will do is John and I will pull our heads together and make sure we get responses to folks, and we'll include those on our website. We'll put a fact sheet, an extra page maybe in the webinar itself, so we'll have those answers for folks. I would like to thank you all for joining us today. If you have any questions, please feel free to reach out to John or I. John, thank you for your time. I appreciate it.
Thank you, Cindy, for being a great partner and for hosting us today.
And to all of everybody still on the line, we all thank you for the work you do every day to serve our homeless veterans. Have a great day, everybody.